Title: What your poop is telling you about your health, and why you should listen. A complete guide from Living Well Daily. Welcome, dear viewers, to Living Well Daily, where we explore the hidden language of your body, one day at a time. Today, we're diving into a topic that most people shy away from, but one that can unlock powerful insights into your overall well-being. Your poop. Yes, you read that right. This isn't just another digestion video. It's a deep, honest, sometimes funny, sometimes surprising exploration of one of the most underrated tools for health awareness. By the end, you'll not only understand your gut better, you'll gain practical tips to optimize your digestion, energy, immunity, and more. Let's get started. Part 1. The Taboo Truth. You were probably caught off guard when you clicked on a video about poop, but here's the truth. Your stool is a mirror of your inner health. Every time you go to the bathroom, your body is giving you direct feedback about how it's doing. Ignoring this feedback is like throwing away your medical test results without reading them. We've been conditioned to think it's gross, but poop is the final product of everything your body does to keep you alive: digestion, absorption, detoxification, and elimination. Poop equals communication. When you learn to interpret it, you unlock a deeper understanding of your health. And here's the kicker: most chronic illnesses start in the gut. Inflammation, fatigue, autoimmune flare-ups, they often originate with gut dysfunction. And one of the earliest signs? Changes in your poop. Poop isn't just the end of digestion, it's the beginning of awareness. Part 2. Understanding the Bristol stool chart. To help decode what your poop is telling you, scientists developed a tool called the Bristol stool chart. It categorizes human stool into 7 distinct types, each representing a different level of gut health and digestive speed. Here's a quick overview. 1. Type 1. Separate hard lumps, like nuts, indicate severe constipation. 2. Type 2. Lumpy and sausage-like, mild constipation. 3. Type 3. Sausage shape with cracks on the surface, considered normal. 4. Type 4. Smooth, soft sausage or snake, ideal, healthy bowel movement. 5. Type 5. Soft blobs with clear-cut edges, borderline loose. 6. Type 6. Fluffy pieces with ragged edges, mushy, mild diarrhea. 7. Type 7. Watery, no solid pieces, severe diarrhea. Why does this matter? Because the shape and consistency of your stool can reveal whether your digestive system is working too slowly, too quickly, or just right. If your stool is hard and dry, type 1 or 2, it could be sitting in your colon too long, and your body is reabsorbing too much water. If it's watery and loose, type 6 or 7, it may be passing through too quickly, preventing proper nutrient absorption. Types 3 and 4 are your sweet spots. If you're here, congratulations, your gut is likely happy and functioning well. A printable Bristol stool chart can be a great tool to track your digestive health over time. Consider keeping it near your bathroom journal or using it to discuss your health with a practitioner. Part 3. Poop shape and what it reveals. Let's start with the tough stuff, types 1 and 2. Hard, dry stools that are difficult to pass often mean you're not drinking enough water. Your fiber intake is too low, or your gut motility is sluggish. People with these poop types may experience bloating, fatigue, even headaches. Real-life example. A 40-year-old man with daily fatigue and stomach discomfort improved dramatically by increasing his fiber from 10 g to 30 g per day and drinking an additional liter of water. In 2 weeks, he was having daily type 4 stools and felt more energized. Type 3 and 4? That's your gold standard. Smooth, well-formed, easy to pass. It means your digestion is balanced, your hydration is adequate, and your microbiome is probably thriving. Types 5 through 7 start to signal a problem. Loose or watery stools often point to rapid transit time, which can reduce nutrient absorption. Common causes: stress, food sensitivities, infections, IBS, antibiotics, or even excess magnesium. Helpful tip: it's soluble fiber like oats, applesauce, or bananas. These bind excess water and slow things down naturally. Your poop consistency can also reflect hormone shifts, especially for women. Estrogen dominance, thyroid imbalance, or even menstrual cycles can affect bowel regularity. And don't underestimate posture. Squatting or using a stool to elevate your feet can dramatically change how easily stool passes. Another angle to explore is your nervous system, particularly the vagus nerve. This powerful nerve runs from your brainstem to your colon and plays a huge role in peristalsis, your gut's wave-like movements. Deep breathing, cold exposure, and humming can actually help stimulate it, supporting better motility. Part 4. Poop Color Guide. When to worry. Normal poop should be medium to dark brown, thanks to bile from the liver. But when your stool changes color, it may be trying to tell you something important. Green, usually from leafy greens or food coloring. If persistent, it may indicate rapid transit time or bile imbalance. Yellow and greasy could mean poor fat digestion, possibly due to pancreatic insufficiency or celiac disease. If it floats and smells especially foul, consult a professional. Black may signal internal bleeding, especially if it's sticky, but it can also be caused by iron supplements or certain foods like black licorice. Red, often caused by beets or food dyes, but can also suggest bleeding in the lower GI tract, always worth investigating. White or gray may suggest a bile duct obstruction or liver/gallbladder issue. Seek medical advice immediately. Bonus tip: medications, supplements, and even antacids can affect stool color, so consider your recent intake before worrying. Visual changes are among the easiest to spot, yet most people overlook them. Start paying attention. Your gut will thank you. Part 5. Floating versus sinking poop. It may sound strange, but whether your poop floats or sinks says a lot about your digestion. Floating stool can indicate excessive gas or fat malabsorption. This can occur in conditions like celiac disease, chronic pancreatitis, or after gallbladder removal. Sinking stool is actually a good sign. It suggests that your body is absorbing nutrients properly and your fiber intake is balanced. If your poop floats and appears greasy or has an oily sheen, you might not be absorbing fats efficiently. Look into your bile production or digestive enzymes. Also, a healthy gut microbiome plays a big role in stool density. Beneficial gut bacteria produce short-chain fatty acids that help normalize digestion and stool form. Part 6. The Power of Smell. Poop will never smell like roses, but a sudden, extremely foul odor is worth noting. Potential causes of foul-smelling stool include bacterial imbalance in the gut, infections like Giardia or food poisoning, undigested proteins or fats, lactose intolerance. If your stool suddenly starts smelling like sulfur or rotten eggs, or you notice a chemical-like odor, it's time to investigate. Diet plays a huge role. High-protein diets often create a more pungent odor due to sulfur-based amino acids. Try balancing with more vegetables and fiber. Also, chronic foul odor may be linked to leaky gut, where your gut lining becomes more permeable, allowing toxins and bacteria to leak into your bloodstream. Part 7. Healthy gut, healthy poop, what you can do to get your digestion on track and keep your gut happy. Eat 35 g of fiber per day, mix of soluble and insoluble. Include fermented foods like kimchi, kefir, yogurt, or sauerkraut. Stay hydrated, at least 8 to 10 cups of water daily. Exercise 20 to 30 minutes per day to stimulate gut motility. Sleep 7 to 9 hours per night. Your gut heals while you rest. Reduce processed foods and sugar, which feed bad bacteria. Helpful supplements. Probiotics. Look for diverse strains like lactobacillus and bifidobacterium. Magnesium citrate. Great for gentle constipation relief. Digestive enzymes. Help break down fats, proteins, and carbs. And don't forget to chew thoroughly. Digestion starts in your mouth. Eating slowly helps ease the load on your gut and improve stool consistency. Part 8. Real stories from real people. This isn't just theory. Stool awareness has helped countless people catch issues early. A teenager with normal stomach aches discovered a serious dairy allergy after tracking her diet and poop symptoms. Within weeks of cutting dairy, her skin, energy, and digestion all improved. A middle-aged man had loose stools for months and assumed it was stress. But after testing, he found a parasite from a trip abroad. Proper treatment fixed the issue. A young woman with daily bloating and fatigue learned she had SIBO, small intestinal bacterial overgrowth. With targeted treatment, her mood and focus improved. These stories show us your poop is a powerful signal. When you listen to it, you gain a head start on better health. Part 9. The beet test. Check your transit time. Here's a simple, natural experiment to understand your digestion. The beet test. Eat a serving of cooked beets, about 1 cup. Then check how long it takes for your stool to turn reddish or pink. 12 to 24 hours, normal transit time. 24 to 36 hours, slow transit, possible constipation or sluggish motility. Track this in a journal along with your meals, water intake, and stress levels. You'll start seeing patterns, and once you know what's typical for your body, it's easier to notice when something's off. Part 10. Final thoughts and takeaways. Your poop isn't just waste, it's data. It's your body sending daily messages about digestion, inflammation, absorption, hydration, and even stress. Let's stop flushing away the opportunity to learn from it. Remember, look for changes in color, texture, smell, and frequency. Keep an eye out for red flags, blood, mucus, persistent diarrhea, or constipation. Stay hydrated, eat well, move daily, and manage stress. When in doubt, track, test, talk to a professional. You don't need to obsess, but you do need to pay attention, because sometimes your gut knows before your brain does. Subscribe for more. If this video helped you better understand your body, don't keep it to yourself. Hit the subscribe button and join us here at Living Well Daily, where every week we decode your body's signals and turn confusion into confidence. Speech balloon, drop your questions in the comments. What surprised you most? Have you ever had a gut feeling that turned out to be true? Until next time, stay curious, stay well, and hey, check before you flush winking face.